Urethral or ascending invasion of the bladder. The three methods by which microbes may ascend from the urethra to the bladder are 1. Through instrumentation, 2. By extension upward of a urethral inflammation, 3. By spontaneous ascension of the urethral bacteria. 1. The passage of an instrument into a clean bladder is a frequent cause of cystitis. The gentle passage of a smooth, soft, clean instrument through a normal canal into a healthy bladder never causes cystitis. Perhaps bacteria are carried into the bladder by every instrument. Perhaps numerous pathogenic bacteria are introduced in this manner. But experiment and experience unite to proclaim that the healthy bladder is thoroughly able to sweep itself clean of these enemies. But this is not enough. The bladder may be thus protected, but not so the posterior urethra. Not to mention the gonococcus, any of the bacteria enumerated above can take root in the prostatic portion of the canal, if only the soil is sufficiently harrowed to receive the seed. Inasmuch as every passage of an instrument into the posterior urethra contuses that canal, at least to a slight degree, it is impossible to reproduce clinically the laboratory condition under which bacteria may be safely introduced into the bladder. Ascending infection of the urinary tract, like descending infection, requires a contributory cause as well as a bacterium. But clinically, the contributory cause is ever present. No passage of a urethral instrument is entirely free from trauma. It is therefore the surgeon's first duty to see to it that his passage of urethral instruments be as cleanly as possible. His second duty, as important as the first, that the instrumentation be as gentle as possible. But inasmuch as the normal anterior urethra cannot be made wholly aseptic, while the bladder into which the urethral instrument passes and the prostate over which it passes are often already diseased and contain in themselves the contributory causes of infection, and even, in the case of the chronically inflamed prostate, the bacteria themselves, it is obvious that no amount of cleanliness or of gentleness will protect the bladder against infection when instruments have repeatedly to be passed, as, for instance, in the treatment of prostatic retention. 2. Infection of the bladder by direct extension of urethritis occurs in gonorrhea and in stricture, also possibly from the prostate in cases of prostatic retention. Direct extension of urethritis to the trigone is even commoner in women than in men. 3. Whether the bacteria of the uninflamed anterior urethra can ascend to the bladder against the urinary stream is not yet definitely determined.